Singapore Nursing Board Important Question and Answers. 1. Following general anesthesia for hip replacement, an elderly client's vital signs are P. 80, R. 14, BP 110/78 of a millimeter Hg, O2 saturation is 100% on 40% mask, and pain is 2/10. The client is shivering and complains of being cold. The first nursing priority should be to A. Remove the oxygen. B. Check the temperature. C. Apply warm blankets. D. Give pain medication. Answer. C. Apply warm blankets. Rationale. Shivering increases oxygen consumption. Hypothermia associated with the perioperative period may cause arrhythmia, clotting problems, and impaired wound healing. 2. A 78-year-old client with CHF is being discharged home where his wife, who has chronic obstructive pulmonary disease, plans to care for him. The wife indicates that the family will help. The correct action by a nurse would be to E. Recommend a nursing home placement for the couple. B. Contact a healthcare practitioner to determine C. If the wife is able to provide care. Determine if the family members will help. D. Offer to make referrals for community resources to assist the couple. Answer. D. Offer to make referrals for community resources to assist the couple. Rationale. This action supports the client and wife in this decision. 3. A client with age-related hearing loss is complaining to a nurse about being frustrated with hearing difficulties. Which sound is most difficult for the client to hear? E. Recording of a march played softly. B. Young children talking. C. Motorcycle on the street. D. A man's voice in an elevator. Answer. B. Young children talking. Rationale. Higher-pitched sounds typically made by children are more difficult to hear. 4. Which conditions increase the risk of the older adult client developing a decubitus ulcer? Select all that apply. E. Osteoarthritis. B. Impaired circulation. C. Incontinence. D. Malnutrition. Answer. B. Impaired circulation. Rationale. Impaired circulation will lead to skin breakdown in a decubitus ulcer. 5. An older client complains of colored rings around the light bulbs in the room. The correct response by a nurse would be E. Is there a history of cataracts in your family? B. I don't see any colored rings in the light bulbs. C. Have you had your eyes checked for glaucoma? D. Have you fallen recently and hit your head? Answer. C. Have you had your eyes checked for glaucoma? Rationale. Colored rings or halos are characteristic of glaucoma. 6. Which condition is most likely to cause chronic pain in an older adult? E. Osteoarthritis. B. An old fracture. C. Sinus headaches. D. Peripheral neuropathy. Answer. A. Osteoarthritis. Rationale. Osteoarthritis is a common cause of chronic pain related to the aging process. 7. The care plan for an older adult with asthma, chronic obstructive pulmonary disease, and chronic anxiety should include, select all that apply. E. Inhalation therapy and instruction about methods of conserving energy. B. An exercise program to increase the vital capacity of the lungs. C. Respiratory exercises with emphasis on forced inhalation. D. Oxygen therapy at 4 L per minute is needed, and deep breathing for relaxation. Answer. A. Inhalation therapy and instruction about methods of conserving energy. Rationale. The actions are appropriate for the older adult and will improve ventilation. 8. Which sign, symptom in an older adult is most indicative of a urinary tract infection? E. Confusion. B. Painful urination. C. Fever above 102 F. D. Urinary frequency. Answer. A. Confusion. Rationale. By the time a UTI is diagnosed, the older adult may begin to show signs of urosepsis, with altered mental status. 9. A nurse should include the risk of developing vaginitis when teaching an older adult woman about A. Anticoagulation therapy. B. Resuming sexual activity. C. Effects of poor nutrition. D. Prolonged antibiotic therapy. Answer. D. Prolonged antibiotic therapy. Rationale. Antibiotic therapy alters the normal protective organisms and allows fungal or yeast infections to develop. 10. An elderly client, who underwent a total hip replacement 3 days ago, asks why, Crossing my legs is prohibited. The correct response by a nurse is based on the knowledge that A. Abduction can cause dislocation of the prosthesis. B. Adduction can cause dislocation of the prosthesis. C. Pressure on arteries in the legs can cause blood clots. D. Avoiding acute flexion of the hip prevents contractures. Answer. A. Adduction can cause dislocation of the prosthesis. Rationale. Crossing the legs, or bringing the legs together, exerts pressure on the hip and increases the risk of dislocation. 11. An older adult with osteoarthritis reports pain, stiffness, and deformities of the fingers. Which nursing actions would be appropriate? Select all that apply. A. Application of cold packs. B. Teaching hand exercises. C. Scheduling meditation therapy. D. Giving prescribed vitamin therapy. Answer. A. Application of cold packs. Rationale. Cold or heat will help the pain, but not flexibility. 12. Which older adult client is at greatest risk of developing hypothermia? A client with a sedentary lifestyle. B. A client who is shivering. C. A client who complains of being cold. D. A client with increased body fat. Answer. A client with a sedentary lifestyle. Rationale. The older client who is inactive is likely to have poor circulation and loss of subcutaneous fat. 13. A nurse is teaching an elderly client with right hemiplegia and severe speech impairment how to dress. An appropriate first step in the teaching would be to A. Ask the client to put on a shirt. B. Demonstrate the correct way to put on a shirt. C. Explain the difficulties in putting on a shirt. D. Give verbal instructions on dressing techniques. Answer. B. Demonstrate the correct way to put on a shirt. Rationale. Demonstration is the best approach to teaching this client. 14. To prevent injury, a nurse should advise an older adult who is taking tricyclic antidepressants to A. Eat a diet high in roughage. B. Get an additional night light. C. Provide lubrication for the oral mucosa. D. Stand up slowly from sitting or lying positions. Answer. D. Stand up slowly from sitting or lying positions. Rationale. Tricyclic antidepressants cause orthostatic hypotension. 15. A nurse should monitor an older adult more closely for adverse reactions to medications if the client history includes A. CHF and COPD. B. Colitis and polycythemia vera. C. Hepatitis and glomerulonephritis. D. Diabetes and cholecystitis. Answer. C. Hepatitis and glomerulonephritis. Rationale. Drugs are detoxified by the liver or the kidney. The client would be at risk for adverse drug effects when the function of the liver or kidneys is impaired. Nurse should include teaching about fall prevention if the client has been taking A. Diphenhydramine. B. Ferrous sulfate. C. Guaifenesin. D. Loratadine. Answer. A. Diphenhydramine. Rationale. Benadryl causes drowsiness. 17. While waiting to be seen in an emergency department for possible CHE, an elderly client with moderate dementia jumps up and says, "I have to go feed my chickens now." A triage nurse's most appropriate response is A. All right, you may leave. B. Please tell us about your chickens. C. That noise was the TV, not chickens. D. You are not on the farm anymore. Answer. B. Please tell us about your chickens. Rationale. Unlike techniques used with the client who is mentally ill, the nurse would not attempt to orient the client with moderate or severe dementia to person, place, or thing. 18. To improve an older adult's sense of security, a nurse should A. Focus on increasing socialization skills in the client. B. Connect the past with the future through pictures. C. Provide praise and recognition for past accomplishments. D. Review comforting memories using reminiscence. Answer. C. Provide praise and recognition for past accomplishments. Rationale. Focusing on long-term memory helps maintain self-worth and self-esteem in the client. 19. A healthy, older adult client complains of dry, itchy skin. The correct response by the nurse is A. Avoid scratching the skin to minimize the risk of infection. B. Drink fluids and shower instead of taking a bath. C. Take fewer baths, use soap sparingly, and apply lotion afterward. D. Wear cotton clothing and use a hypoallergenic soap. Answer. C. Take fewer baths, use soap sparingly, and apply lotion afterward. Rationale. This response will lessen the dryness and relieve the itching. 20. A 90-year-old client's condition is one of lethargy, poor capillary perfusion, and urinary incontinence. These findings should indicate to a nurse that this client is at greatest risk for a. Aspiration, b. Contractures, c. Dehydration, d. Skin breakdown. Answer. D. Skin breakdown. Rationale. All of the conditions are risk factors for skin breakdown: inactivity, poor circulation, and skin wet from urine. 21. An 80-year-old client complains of sleeping less and awakens several times during the night. The client takes acetaminophen at bedtime and does not drink caffeine. Which response by a nurse is most appropriate? E. Tell the client to eliminate fluids after 6 p.m. B. Recommend that the client go to bed 1 hour earlier. C. Recommend a sleep study to diagnose sleep apnea. D. Tell the client that the sleeping pattern normal age-related change. Answer. D. Tell the client that the sleeping pattern normal age-related change. Rationale. The older adult does experience changes in sleeping. It is important to rule out any pathological patterns. 22. Assessment of an older adult with pneumonia will often reveal, select all that apply. E. Anorexia and changes in behavior. B. Headache and difficulty breathing. C. Muscle aches and fever. D. Non-productive cough and chest pain. Answer. A. Anorexia and changes in behavior. Rationale. The signs of pneumonia are more subtle and subjective and are related to developing sepsis. 23. A 73-year-old client is admitted for rehabilitation after a mild stroke. The client complains of not feeling rested, begins to nap during the day, and sleeps only 4 to 5 hours nightly. The most appropriate nursing action is to E. Assess the client's sleep-wake cycle to determine necessary interventions. B. Do nothing as the sleep pattern is associated with normal aging. C. Determine if the client takes a medication for sleep at bedtime and request an order. D. Relocate the client to a different room that is quieter. Answer. A. Assess the client's sleep-wake cycle to determine necessary interventions. Rationale. These are strategies to promote better sleep. 24. An 87-year-old man, who has been living independently, is entering a nursing home. To help him adjust, the most effective action is to E. Involve him in as many activities as possible so he can meet other residents. B. Move him as quickly as possible so that he does not have time to think. C. Restrict family visits for the first 2 weeks to give him time to adjust. D. Suggest that he bring his favorite things from home to make his room seem familiar. Answer. D. Suggest that he bring his favorite things from home to make his room seem familiar. Rationale. It is important to create a familiar environment. 25. When preparing to perform discharge teaching with an older adult client, which nursing actions will facilitate learning? Select all that apply. E. Involving family members in the teaching sessions. B. Keeping the pace slow, presenting a small amount of material at a time. C. Using repetition as well as providing reinforcement, such as written material. D. Providing ample opportunity for repeated practice sessions. Answer. A. Involving family members in the teaching sessions. Rationale. Family members provide a source for reinforcement as well as valuable assessment information about the client's living situation and learning needs. 26. In preparing a health education presentation for older adults, a nurse should keep in mind that A. Older adults generally prefer group teaching. B. Older adult learners need more than a single teaching session. C. Presentations should use more written materials than lectures. D. Videotapes and pamphlets ensure teaching effectiveness. Answer. B. Older adult learners need more than a single teaching session. Rationale. A single teaching strategy is rarely adequate. Learning takes time. Follow-up sessions are important to building confidence in the client and to assess the effectiveness of prior teaching. 27. Which statement by the family caregiver of an older woman with incontinence requires teaching by a nurse? E. It is too bad incontinence occurs with aging. B. Incontinence has been so embarrassing for my mother. C. Mother says her incontinence is related to the number of children she had. D. I am relieved to know mother's incontinence may be reversible. E. It is too bad incontinence with aging. Incontinence is not a normal of aging. Age-related changes in urinary tract predispose the older client to, but incontinence is a symptom of possible disorders, not just aging. 28. A 63-year-old client is returning home after being hospitalized for injuries received during a home invasion and robbery. Although neighborhood robberies are rampant, the client has lived in the same house for 50 years and does not want to move. The client receives a monthly social security check in the mail. The most appropriate action by a home health nurse would be to select all that apply. E. Advise the client to arrange for someone to visit regularly or move into the home. B. Advise the client to have the social security check deposited directly to the bank. C. Suggest the client get a dog. D. Advise the client to get a locking mailbox to prevent mail theft. Answer. B. Advise the client to have the social security check deposited directly to the bank. Rationale. Removing the target reduces the risk. Answer 3 is correct because a dog will likely deter a robber. 29. A nurse in a senior adult daycare program observes that the participants have long toenails, corns, calluses, and other problems indicating a need for foot care. What is a nurse's correct action? E. Schedule podiatry services at the site after a class on foot care. B. Establish a regular foot care plan whereby the participants' toenails would be cut and corns and calluses removed. C. Instruct family members in the proper methods of cutting toenails and using commercial foot care products. D. Recommend that the participants soak their feet for 10 minutes before cutting their toenails, using safe toenail clippers. Answer. A. Schedule podiatry services at the site after a class on foot care. Rationale. Ideally, foot care should be provided by podiatric care providers. The service is covered by insurance. 30. The incidence of tuberculosis in the older adult is significantly increased among individuals who A. Are physically inactive. B. Are cigarette smokers. C. Have received the Bacillus-Calmette-Guerin vaccine. D. Reside in institutions. Answer. D. Reside in institutions. Rationale. The spread of the infection increases in crowded, close living conditions since TB is spread from person to person by airborne transmission droplets from talking, coughing, sneezing, laughing, or singing. Thank you for watching.